Hi everyone, I hope you're well. Today we are going to discuss about deep margin elevation. Let's look at this clinical radiograph. Of course, you don't have enough information, clinical photos, all the rest of it. But if you, by just looking at this radiograph, we can see that the patient has quite deep caries distally. Assuming that the tooth is restorable, my preferred method of restoring this tooth is by doing a deep margin elevation, sealing the tooth, doing a root canal treatment, and then providing patient with onlay. Because if we are now, as you can see from the x-ray, that the half of the tooth is restored with restoration. So once we remove it, we only have mesial marginal ridge left. And if we start doing crown preparation, we are going to lose a lot of tooth tissue. And that's why I prefer to do an onlay. And the onlay, when I'm doing, I always use adhesive method to bond onlay. The problem with that is that you cannot bond subgingivally predictably, especially when you cannot isolate subgingivally. So you need to make sure that you are raising that margin up in order to bond your onlay, and that's why it's called deep marginal elevation. You're elevating this deep margin. Once you remove the caries, the floor of the tooth, you are erasing it to a supragingival level where you can then put a rubber dam, and when you're bonding onlay, you can do that. So that's why I prefer deep margin elevation technique in order to restore these type of teeth. When we are doing deep margin elevation, such as this same tooth, as you can see, the restoration is very close or at the crest level, and many dentists get worried about encroaching into biologic width. Studies have shown that the concept of biologic width is there when you're doing indirect restoration, where there is a gap between the restoration and the tooth. So we know that whenever we're doing indirect restoration, there is some space between the restoration and the tooth. There is no complete seal, and that's where you have biological width issue. If you have complete seal in this case, you do not have that kind of issue. I have done hundreds of extreme cases like this with very success over 12 years. And the key is that to make sure that the seal is very accurate and you're not leaving the gap. If you leave a gap, then yes, biological width will become an issue. And as you can see in this case, we have restored tooth with the onlay and by doing a root canal treatment. Now, when you're doing deep margin elevation, there are a few tips and tricks you can use. So one of them is make sure that you have used curved matrix band, or you can cut the matrix band in order to modify it. If you would want me to show you how it's done, just drop me a message. I can send you a video of me cutting Toffelmeier matrix band in order to make it a greater curve matrix band. However, if you just want something ready-made, then if you can go to www.greatercurve.com, you will find these matrix bands which are greater curve, because what you're trying to do is you're trying to go past the maximum bulbosity on near the contact point and go into the sulcus when you're doing the deep margin elevation. It's very, very important. It's also important when you want to have a tight seal against the floor, because you do not want any moisture contamination. If you have a moisture contamination, then you cannot go ahead with the deep margin elevation, and you may want to consider in that case doing a crown rather than an onlay. If I've decided that I'm going to do deep margin elevation, I am still using rubber dam. It's difficult in this situation to push the rubber dam subgingivally, but you can use rubber dam in order to isolate the area around it to reduce any contamination. So make sure that you have isolated the area in order to do this treatment. So what are the 3 tips in order to achieve and have deep margin elevation to a standard which is acceptable? A, make sure that you have perfect isolation. If isolation is not good, then you cannot go ahead with the treatment. You can use greater curve matrix band or sometimes double matrix band technique with the PTFE in between the matrix band in order to get that perfect adaptation. But without adaptation, you cannot proceed forward. You need to make sure that you use highly filled bond, such as OptiBond FL. And OptiBond FL is my go-to bond when I'm doing any bonding, but it becomes much more important when you're doing this type of treatment. So OptiBond FL is one of the ideal bond to use in this kind of technique. Also make sure that you heat your composite in order to make it a little bit softer and easy to adapt, because it's difficult to look down through that cavity and adapt your composite really well. And this is the reason many times dentists use flowable composite in order to get that perfect adaptation. The problem with flowable composite is that they shrink more than normal restorative composite. So if you are going to use flowable composite, use composite with a low level of shrinkage. So if I am using anything, I use Genial injectable, which has proven low level of shrinkage. So make sure that you do that, use that if you are not comfortable using composite. One tip is that when you're using flowable composite, just make sure you don't incorporate any air bubbles, because it's very easy to incorporate air bubbles when you're just flowing something there. So just be aware of that. So I hope the short video on deep margin elevation was useful and hopefully cleared some of the issues for you. If you need any more information, please feel free to contact me on my social media pages, or contact me via my email, via my website, which is www.drdevangpatel.com. And if you like this video, please share with your friends and colleagues. That would be great. In the next video, I am going to discuss about onlays and when I choose to do onlays and my preparation type.